similar to those of other orthopaedic manual therapy techniques, such as instrument-assisted soft tissue mobilisation and certain massage techniques. The first mechanism of action is that of fluid dynamics, which refers to the movement of tissue fluid between blood and lymphatic vessels. The changes in pressure may stimulate the lymph nodes, and the pressure vacuum within it causes local vasodilation. This increase in blood flow would help to desensitise the area, which is the same mechanism for massage techniques. The mechanical effects differ, however, in that we are providing a decompression to the tissues as opposed to a compression. Lastly, neurological aspects may also be elicited by helping desensitise myofascial trigger points and stimulating the Golgi tendon organ. Through this, we may see the temporary inhibition of hypertonic muscle. We will cover the different cups that we can choose to use in our daily application, how to use them, the retention times that we may want to apply for, along with the level of suction that we want to apply, hygiene, which is a very important part, and then a small conclusion as to how to integrate and what is best for you. So firstly, as you can see, we have different types of cup here sat in front of us, made from rubber, plastic and silicone. These silicone and rubber ones work in a similar manner, in that we will depress them first, apply to the area, and then as they come up, they will provide some amount of suction. And we can just squeeze to release. And again, with these silicone ones, we will depress and apply, and as they raise back up, they will provide some form of suction. And again, we will peel to release. You can see during the workshops, we used plastic ones here for ease, as this is what we find easier from day to day. And you can see there's a little curvature here on this one, which will lend itself to certain parts of the patient's anatomy. And we have begun to apply those, we can apply different levels of suction, and then to release, we can just pull this little nozzle here, which allows us to take that off nice and softly. So we can use them in any number of manners, from passive treatments, so having the patient in any position on the bed and working through a range of areas. We can then add mobilisations or even active elements into the technique to allow the patient to get off the table and make the treatment a little bit more integrated. The retention time, depending on your clinic, will be anything from 3 to 5 minutes if you're integrating cupping with different modalities such as dry needling, mobilisations, or if it's a standalone treatment, you may be using the cups for 20, 25 or even 30 minutes. A point to note here is that the longer the retention time, the higher probability of bruising the patient. And again, reiterating the points that we made at some points during the course, more doesn't necessarily mean more, in that the more cupping or the more bruising that we elicit or use does not necessarily translate to a better experience for the patient. So we need to ensure we're working within the tolerance levels of the patient and working to make sure it is a therapeutic session. Another point, as we mentioned, is hygiene. Hygiene is a very important part here, as we want to ensure that infection prevention control is well managed. After using a cup, with every patient, we need to ensure that the inside and the outside is fully disinfected using a disinfectant that is safe to touch the skin. And this is very important, working long hours, long days, seeing multiple patients, ensuring that each patient receives the cleanest cup or hardware that we are using. So in conclusion, have a try of each different type of cup, find what is best for you, which you feel most confident and competent applying, and most importantly, what your patients are receiving, so if it's the most therapeutic benefit. And there's no need to go out and buy the most expensive glass cups or plastic cups on the market, as each cup here, regardless of the makeup, rubber, plastic, silicone, glass, still provides the same benefit. Right? So there's no need to go out and spend more. So to end, ensure that you're integrating this into your daily practice as best you can with other modalities such as instrument-assisted soft tissue mobilisation, dry needling, manipulations, and certainly exercise rehab post-treatment looking to return your patient to a better version of themselves before the issue arises. Contrary to what you may have been told, there are zero therapeutic benefits related to the volume or intensity of bruising elicited post-treatment. The patient may be left with cupping marks, but they do not directly relate to or represent stagnant blood or unhealthy tissue in that area. The marks left by the cups are due to capillary hemorrhage and may last up to 1 week. As with all modalities, more is not always more, meaning more bruising is not equal to better treatment. Ideally, we should look to leave the patient with the least amount of bruising possible. Further to this, care should be taken with certain patient populations, such as those with clotting disorders or those that are on anticoagulant medications. We will cover more on this later within the contraindications and precautions section. Informed consent is a vital part of our daily practice, regardless of the adjunct being used. As a therapist, we must ensure that we fully make the patient aware of the intended benefits of the modality, along with the possible side effects. To carry this out effectively, we must thoroughly screen the patient through a comprehensive subjective and objective assessment. Not every patient will be receptive to the modality that you deem appropriate, and you must also discuss with them any alternatives and compare the options on offer to both. This must be done in a manner whereby the patient can fully understand each aspect and from there be able to make their own decision about the treatment. The law relating to consent is governed by case law and evolves on a case-by-case basis, except in an instance where people lack the capacity to make their own decisions. Their consent is determined by statute law. It is essential that you carefully document the consent process to show that the patient or their representative is happy to proceed with the treatment. This is a passive with glide technique to the cervical spine erectors. We are going to encompass elements of levator scap, fibres of the upper trap, sternocleidomastoid and splenius capitis. We're going to start high up on the neck at the patient's hairline and work our way down towards the attachment to the levator scap on the scapula. We're going to apply as much suction as required and working within the patient's tolerance levels. This technique can be applied to patients that are suffering from conditions such as chronic type headaches, migraines and whiplash associated disorder. Once you're happy with the length of treatment for the passive aspect, we can then move on to a gliding technique. So you can see here we have removed the remainder of the cups and just left with one. Depending on the size of the patient, you may wish to use two at the same time. For this technique here, we're going to adjust the level of suction so that it's tolerable for the patient and to allow us to glide. And all we're going to do is gently and slowly glide the cup up and down the line of the cervical spine. And then we're going to slowly work our way over, moving more laterally and just working down towards that insertion of levator scap. And once we're happy treating one side, we can then move over the spinal area and then move more over into the soft tissues. Again, encompassing the whole aspect of the upper fibre traps down to levator scap.